good evening. Welcome to My IVF Answers and the European Fertility Society. We are back once more. Today we are talking about egg donation, and we have our special guest with us, Dr. Pavel Otterwell. You can see him right here. Hello, it's great to have you.
Yeah,
We are connected to Prague right now. No, it's not Prague. Remember,
it's Brno. It's
it's
Brno.
Brno,
Yeah.
right? Sorry about this. Exactly. Dr. Pavel is the medical director at Reprofit. So I'm really happy to have you back. We already established that we did some webinars in the past. It was a few years ago during pandemic time. So I'm happy to have you back with us today. And as always, let me remind everyone that we will start with Dr. Pavel's presentation on our topic, where he will explain when is egg donation indicated, how the donors are matched, and of course a little bit about the process at his clinic, Reprofit. But afterwards, your favorite part, the questions and answers. So remember, you just need to put those in the chat, and Dr. Pavel will simply answer them for you. So don't hesitate. As always, it's this time for the questions. So anything that's on your mind, you can definitely type those in the chat. I already see the first question in this chat, so thanks a lot for that. But of course, as I mentioned, we will start with the presentation first, and then we will go for your questions, so you can put them right in the chat as well. All right. I think that's it. We can go ahead with our topic today. Dr. Pavel, are you ready to start?
Yeah. Okay.
Brilliant. Thank you so much. Then let's go.
Yeah. Okay. Thank you for a nice introduction. You mentioned Brno. Yeah, Brno. It is not Prague. Yeah, Brno is 200 kilometers from Prague by highway. From Prague as a capital of Czech Republic, and approximately 100 kilometers from Vienna, capital of Austria. And also we have a small airport here in Brno with, for instance, a direct flight to London Stansted. Yeah, so this about Brno and Reprofit. That is a clinic with almost 20 years history. Our name from the beginning is Reprofit International. Yeah, because it was founded as a really focused clinic for egg donation. So our history is 20 years of IVF, which means 20 years of egg donation treatment. In my talk, I will describe the process, and I will underline some aspect which I consider to be important. So, for whom the egg donation is dedicated? The main group of patients are patient ladies with exhausted ovaries, producing less on non-oocytes. The majority of them is because of the age, because naturally the amount of oocytes, the ovarian capacity declines during the life. Yeah, and these patients are not able to produce own oocytes, none or a few only. The specific group of patients are younger patients with the same symptoms, but very young, around 30 years of age, called premature ovarian failure. Patients after chemotherapy, the ovarian function was destroyed by medication. Patients, they lost ovaries after surgery from many different reasons, like cancer, like endometriosis and similar diseases. Uh, Patient with genetic problem born without ovaries. And also we have two specific subgroups of patients that are one of, let's say, patients with IVF history, with IVF failures in the past. One is a group of patients producing only poor quality oocytes or embryos, despite doing all what we can. and all patients mostly with unexplained repeated IVF failure, when egg donation for them means to change the strategy without knowing the reason of previous failures. It's time to change the strategy, to change the cells. Yeah. By the way, the egg donation itself is quite well established, because it is not brand new method. Of course, it's over 40 years old method, published first time in the USA, California. What is the reality of egg quality in normal life? Yeah, the oocyte egg as a cell is created when when the embryo is developing. Yeah, so while the future woman is developing in the womb of her mother, the her oocytes already exist. After delivery, when baby girl is born, the oocytes in her ovaries are still there, and they are sleeping until puberty. And through puberty, on monthly basis, the ovulation happens. One oocyte will result in ovulation, and the approximately 60, maybe 100 oocytes every month disappear forever. And it means that in 25 years lady, her oocytes are also 25 years old. But in 25, the capacity of or quality of oocytes is on the top. The genetic profile, the genetic stability of oocytes of young women, 25, let's say, yeah, are very good. The majority of her oocytes are of good genetic profile, no aneuploidy or low ratio, low proportion of aneuploidy, and they are very strong in terms of energy supply. So it means that embryo created from young oocyte is able to be developed very well with very likely good genetic profile. However, 20 years later, yeah, the oocytes are 45 years old, as a lady is. Yeah. And during this lifespan, 20 years between 25 and 45, every impacts of environment, of behavior, of food is concentrating in oocytes, resulting in her poor genetic quality and declining energetic supply of oocytes. And if this oocyte is fertilized, the probability of reaching good quality and genetically stable embryo is very low. Yeah, in IVF, we can observe that if a young oocyte embryo is implanted, is inserted to womb, the probability of implantation is roughly 50-50. But if we are lucky and we have a genetically or not genetically, the embryo created from 25 years old lady, and the embryo is implanted to uterus without genetic testing, without knowledge of its genetic profile, the probability that embryo will implant is 1 to 30. Yeah, it's a main difference, because the female age matters. And the idea of egg treatment is to replace old egg by young egg. So what has happened is that there is no impact of recipient age. There is only impact of age of donor. Yeah, so this is clear. And what statistics show us? Recipient age doesn't matter. The probability of having baby after using egg donation stays stable despite the age of recipient. Why? It is possible. It is because of the miracle of immunity tolerance. Yeah. So because even natural conceived embryo is half of half from male. Yeah. So female's body is able to accept embryo despite the genetic origin, and immunity origin is different from her own body. Yeah, and thanks to this ability of body to accept, we can use the treatment like egg donation treatment. So there is no question if can I accept this embryo despite it's not my own egg. No, it's already solved by nature. A few, one or two slides about legal frame in Czech Republic. If the couple will travel to Czech Republic, they will be treated in Czech legal frame, which means that we can treat only on anonymity basis. Recipients will receive only limited information of about the donor. They don't know who exactly the donor is. The donor doesn't know for whom she is donating. However, her medical records must be stored here and archive for 30 years is the law. It is the must. We have medical records, and from last few years we have also DNA samples of the donors. So if in the future there is any need to add some specific test or to obtain some specific information, mostly we are able to provide and to add this information, because of there are some questions from the family of recipients in the future. The age limit of donors is 18 to 35. Maximum age of female recipient is 49th birthday. Still, we have to insist on heterosexual couples. And what is quite new, even for us, is that we have to refer the donation cycles to national registry, and there is allowed to donate only 5 times per one lady. Yeah, so it's controlled, and it is not possible to repeat more than 5 donation in one donor. In practice, we accept the donors up to 32 years of age, despite the legal limit is 35, and the average age of donors is 25.5 here at the Reprofit Clinic. Maybe you know we are part of the chain of clinics. So we have also sister clinic in Slovakia, where they accept recipients up to 52nd birthday. We hope, and we hardly work on them. We are pushing the legal changes. They are being prepared. We hope that in near future, at least single women will be allowed to undergo this in general IVF treatment in Czechia. For your information, briefly, how recruitment of donors looks like. Yeah, so the first step is a questionnaire. The candidate must fill in the questionnaire. they we will realize that this donor is overall healthy, non-obese, non-smoker, good age, typical because we are university city, Brno. So typical donors or candidates for donors are students or young mothers here. If everything is okay, the next steps it is to do the laboratory test. Must be negatively tested for sexually transmitted diseases, and they have to have negative results for drug abuse. If okay, the next steps is interview set. Interview with specialized coordinator and psychologist, and or uh, interview with a genetic doctor, yeah, with very deep uh, screening of information of family, mother, father, grandmother, grandfather, brothers, sisters, etc. Gynecologic test, yeah, to evaluate the ovarian capacity, thyroid gland function, etc. And if everything is okay, the donor, the candidate is accepted, is listed in our DBase, and she is waiting for our call. After finding the recipient, we will contact them and we will start her preparation. More in detail, what does it mean, genetic test in Czech Republic? Yeah, it's quite very well established. Yeah, there is a law, there are rules, they are controlled by controlling body, yeah, state body, controlling that every donor is really undergoing this test with negative results. Some tests are obligatory, guided by the EU legislation, and it's a genetic counseling, normal karyotype, cystic fibrosis, SMA, deafness, and sexual transmitted disease twice during the donation process. The request is all okay, all negative. Uh, each clinic, including us, have the kind of wider panel of tests, making the donation more safe than it's only the basic level. Yeah, so you can see the overview of additional tests we do. So I can tell you that our donors here at Reprofit are tested for at least 11 genetic diseases, and there must be negative in these tests. Uh, it was about the donor side, about the recipient. Yeah, so I will try to describe the typical case, how we we treat our patients. Yeah, the typical first initial step is online questionnaire, which is quite brief. Yeah, just to obtain basic information about couple. The couple is contacted by coordinator. The online or in-person consultation is scheduled with doctor or coordinator. Doctor will consider everything what is related to the treatment, the past treatments, diseases, etc., etc. And after making a decision that egg donation is a good strategy, and if it's acceptable for the couple, the coordinator will start to find a donor. The first step is to finalize the requirement for the correct selection. We appreciate photos of recipients, and depends on how detailed or how easy or complicated it is to find the donor. We need typically 6 to 7 weeks to find the good donor, and the process of donor stimulation and recipient preparation for embryo transfer can start. We prefer, is our main type of treatment is fresh transfer cycle, which requests synchronization of menstrual cycles of donor and recipient. The goal is to have a same day plus minus menstruation, both of them, donor and recipient, lady recipient. And from menstruation, the donor will start her ovarian stimulation, injections, etc., ultrasound controls. At the same time, in the meantime, a recipient is undergoing ultrasound control, taking some pills for endometrium growth, and after finishing both ovarian stimulation and endometrial preparation, we will perform egg collection, fertilization. The goal of treatment is 8 to 16 oocytes because the safety is first, especially in case of donors, because harming donors is a very sensitive issue for many reasons, ethical, legal. Embryos are created, and one embryo is recommended to be transferred day 5 after fertilization, and remaining embryos are frozen. ACG test, and if positive, the patient is referred to gynecologist in her country, and it's good to inform the gynecologist about the origin of oocytes. It's good to tell the gynecologist the age of donor, because it could have a very good importance during the pregnancy controlling and pregnancy tests. The second option is to split the treatment, to create embryos first. Yeah, there is no need to synchronize the cycles. Simply, also embryo is created after donor stimulation and fertilization. We need sperm only. Embryos are frozen, and anytime in the future, separately the endometrium is prepared. Especially, it's very good for patients they have own ovulation. It is the last two groups of patients in my first slide. The patient, they have own oocytes, but they have an ovulation, but they have a reason for undergoing egg donation. So they have own ovulation, so we can use hair ovulation to prepare endometrium. Embryo is ready, and embryo is implanted 6 days after ovulation as a natural cycle. Yeah, so it's a good strategy, and this strategy is discussed during the communication with your doctor, and it's recommended what is better, fresh and frozen, depends on the specific case. What we can offer in terms of different programs. The standard treatment is IVF, as I described it previously. There exists the guarantee that we guarantee that at least 2 top quality embryos must be, one for fresh transfer and at least one for freezing, or at least 2 for freezing. If patient or if the result is not acceptable, there is no good embryo, patients pay nothing, but we have to find a new donor and start from the brand new start. Baby guarantee program, what does it mean? The baby guarantee program means healthy baby is the end, healthy born baby. It's dedicated for recipients without any associated reasons of infertility, but egg quality, basically. Yeah, and the idea is easy. Baby must be born, or money back. Yeah. If you will contact us, the coordinator will provide more detailed information. Yeah. But I think basically it's clear. And if a couple have already the baby born, but unfortunately no embryos frozen, and they would like to have a biologically same sibling, the choice number one is to contact the original donor, or maybe sometimes we have a frozen oocytes of the same donor. And if it, and mostly it is the priority to try to have a biologically identical baby, a sibling, brother or sister, so we can offer to find the same donor. Of course, if there is a still in a legal frame, if he is not, she is not old in the meantime, for instance. Now, what you can see in numbers, yeah, there are results from 2023. We performed exactly 800 egg donation cycles, and we obtained around 11 eggs per each treatment. 9.3 out of them were matured. Fertilization rate 80%, and we obtained 4 good embryos average, which means the typical cycle resulted in 1 fresh embryo transfer, one embryo, and 3 embryos were frozen. Is a typical cycle. Pregnancy rate, positive test, ACG test, above 60. Ongoing pregnancy, when heartbeat of baby is confirmed, above 50. And take-home baby rate, baby is born, 47%. So 47 babies born out of 100 embryo transfers performed. And the typical case, typical time frame, what we see every day, is a typical case. If you decided in January to accept egg donation, you decided that it's your way. 3 months later, you can have positive pregnancy test, with our guidance. Okay, thank you for your attention. It was what I would like to tell you. I see that my camera maybe is not working, but I hope that the question can be answered in a few minutes.
If we do fresh oocyte donor cycle, the donor can have sex and get HIV or hepatitis right before the donation. How can we be sure she doesn't have HIV? In frozen cycles, when we buy frozen donor, oocyte clinics test donors 3 months later. Test
Two issues. Yeah. So the donor, the second test is done on the day of egg collection. Yeah. The first test is screening, to accept the donor, and the second test is done on the day of egg collection, and the result is known before the embryo transfer. So we have 2 tests. One test 3 months old, and one second test the 3 days old. Yeah, so which can cover, and it is in the legal frame in Czech Republic, so it is legal. Yeah, and the second thing is that it was never described in the past that there is possible to transmit this mentioned diseases via oocyte. Yeah, it's a protection recommendation, of course, but it's important for sperm donors. Yeah, for sperm donors, the sperm samples must be frozen because of the reason they are asked now. But egg donation is a different issue that we have to test. Okay, we can accept that these two tests are not able to cover all the theoretical risks, but the transmission of HIV or hepatitis B, C via oocyte during the IVF process was not described, never.
Okay. I think that again answers your question. And of course, if you have anything else you wish to add, you know what to do. Thanks a lot. And the next question is right here. You already mentioned this again, but if you can repeat for our patients. So how long do you need to wait for suitable egg donors? Your donation program really anonymous in Czechia?
Yeah, the waiting time. Talking about fresh donor cycle, yeah, it means the donor must be stimulated and provide fresh oocytes. So waiting time for good match is typically 6 to 7 weeks. Yeah, but if the request is easy, for instance, only university student, yeah, no other request, so we can find donor within 1 week. Yeah,
Okay.
and so if we talk about the frozen oocytes, because it is also the option. Yeah, so we also have batches of frozen oocytes, and we can offer them, but we use it as a backup mostly, as it is a second choice. So that there is very quick offer of donor from day to day.
Brilliant, thank you. Question in regards to Japanese egg donors. Do you have any Japanese egg
We have,
donors?
yeah, because we have a patients requesting this, so we have and it was not easy. We have established cooperation with so-called Asian Egg Bank in California. Yeah, because it was a bureaucracy. Yeah, because it was a struggle, battle of bureaucracy, because it was easy to obtain permission to transport oocytes or on a regular basis. But we did it, and we have a regular cooperation which is approved by our controlling body. Yeah, and if we have a patient with this request, they can turn to Asian bank first. We will organize transportation of frozen oocytes from Asian bank to Brno, and we can start. But standardly, Asian donors are very rare. Exists, but not too much. Not too many.
Of course, and there's another question I was regards to African egg donors.
We have no cooperation, so we have to wait for some volunteers.
And it happens.
They exist. They are Czech citizens. The mother or father or both are of Africa origin. They live in Czech Republic. Yeah, but it's 1-2 ladies per year. It is very.
So waiting time would be definitely longer.
Waiting time. It's not. We have to refuse the patients that they are looking for this origin oocytes, because it's the heritage of socialism here. Yeah, because in Central Europe, there was no mixture of races. It was purely Caucasian white people here.
Okay, but that explains it. Thank you so much. So you already again mentioned from which country do most your donors come from. You mentioned they are most from Czechia, right? Czechia.
95%, maybe 99% are Czech. Czechia.
This is the question we already answered. So let me just go to show you this from Olivia. How does your clinic screen egg donors for hereditary conditions, particularly cancer, severe mental health disorders, Can I
Yes.
specifically request a donor with no
Mhm.
family history of
So
this
yeah,
condition?
yes. So there is two sheets in a genetic questionnaire during the interview with genetician, focused on this type of disorders, psychiatrist and oncology. But of course, are it depends on what the donor is open to tell us. Yeah, so we have no tool how to control it. Yeah, if the patient inform us about something
Mhm.
on this topic in the family, the donor and his family members are asked to come for more detailed investigation.
Mhm.
And we are investigating if the family is open to do it, of course, or the donor is refused, the candidate is refused. But
Mhm.
if the donor is not open, yeah, she is signing that everything what they told us was true, of
Right.
course. Yeah, that they are responsible because of the Czech legislature.
Mhm.
If she signed that everything is true and she lies, it's her problem. Yeah, but yes, if she will cover something or don't tell the
Mhm.
reality, we have no tool how to control that the family is okay. So we are dependent on what the donor fills in the questionnaire. But
Mhm.
if she mentions something, we are initiating investigation on this potential risk.
Mhm. Okay. Again, I think that explains this. And regarding information about donation with surrogacy, do you do anything like that as well in Czechia?
Yes, there is still acceptable that we can perform surrogacy and egg donation, but the husband, the male partner, must be the partner, not the
Mhm.
donor. So double donation and surrogacy is not possible
Okay.
because there is no link between biological
Mm.
parents and surrogate in such a case. So at least one of the parents must have any link to baby.
Mhm.
But very likely the law the is changing. Probably it is not allowed in the near future. Probably the combination of egg donation and surrogacy will be not allowed from 2026. But
Mhm.
we are not sure.
In
The
process. Yeah.
election is coming in Czech Republic in this autumn, so maybe it will not pass. Yeah? But the request in Parliament is to stop using
Mm.
egg donation in combination with surrogacy. We will see next
Of
year.
course. Okay, we need to wait and see them. Okay, thank you for that. And now I will show you the next question, and it's regarding, AI. Do you use AI app to compare the pictures of the donors and the recipient? We want to start a donation cycle with for profit, which is with
Mhm, mhm.
one Russian clinic
Uh,
because they offer
mm,
a frozen
not
eggs, and
not
we
not
think that
yet. Not yet.
okay,
Not yet. No,
okay,
no. No,
so not
yeah,
nothing
it
like
is it
that.
is probably because we do not have the formal pictures of donors. Yeah, so we have
Mm-hmm.
their pictures only from social media. Yeah, but no, it for us it is not the idea we were talking about. No, no.
Mhm. Okay. And there's more question to this actually. So, one Russian clinic course, they offer frozen eggs, and we think that in frozen egg bank there will be someone that will look more like me than between the donors that are
Yeah,
available
good,
actually.
good,
So
good.
it's possible, right?
Yeah,
To
yeah, good. This is our daily job, or not my but my coordinators. If we have a patient, uh, they really insists on this topics, yeah, to have a donor as similar as a recipient. Yeah, so for absolutely understand that for anybody it could be very important, crucial maybe. Yeah, so if this couple can accept the longer waiting
Mhm.
time, talking about 2 months, 3 months, we ask our coordinators to work on it in detail, yeah, and to contact more donors to compare them, and we can find a similar donor if the donor, if the couple on the beginning of matching process will inform us that it's really crucial for them, we can fulfill.
Mhm. Okay. And if someone would like to use a different clinic, for example, and just ship, let's say, the oocytes from one
No, no,
clinic
no,
to
no, no, no,
yours.
no, no. We do not all sites.
Okay.
Never.
That's why I wanted to double check it.
Yeah, the
Okay.
camera is again gone.
It's
Sorry,
okay. We can
sorry.
hear you,
Yeah, yeah.
so
No,
it's all
no, no,
okay.
no, no, no. What we can do, and it's absolutely easy or accept understandable. We can
Mhm.
shift embryos. Yeah, because embryo it
Right.
is a property of couple. Yeah, but
Mm.
never all sides. We are not selling all sides. Yeah.
Okay. Just wanted to clarify this for our
Mm-hmm.
patient, and thank you
Yeah,
for the
first
clarification
because
for this.
because we
Yeah.
have no permission first,
Mhm.
and second it's our attitude. Yeah, we don't want to use all sites for shifting them anywhere. We would like to treat patient.
Okay. Now I will show you next question with a few details, okay? So it's a bit of a longer question. You can see the details here. So basically, a patient had a fresh embryo transfer in November with donor X, which failed. As you can
Mhm.
see, 13 mature eggs, 13 fertilized with Zymuch, ICSI, 11 embryos on day one. My partner is 39. He has low morphology, high DNA fragmentation, normal karyotype. So basically, the question here is, and what may have caused the low blastulation rate, considering the fact that we have used oocytes of a 29-year-old
Mhm, mhm, mhm.
and Zymote multi to select my partner's sperm? What could be done differently to achieve higher blastulation rate? We are
Mhm,
not
mhm.
open to donor sperm, as you can see here.
Okay, so of course it is not easy to answer,
Of
but I
course,
can I can only provide the general rules.
of course.
It depends in general, if the delay of development started immediately after fertilization, so it means that day 2, day 3, well, day 1, day 2, and day 3 of embryo development was lazy, was delayed, it probably it could be this particular batch of oocytes. It could be the reason. If everything went well until day 3 or 4, everybody's happy, and promising, everything's promising, and the embryo arrest or drop decline quality of embryos happened after day 3 or day 4, day 5, it could probably be in sperm, and maybe the combination of different methods of sperm selection could be offered next time. Not only is fertile chip, but also
Mhm.
the different kind of sperm selection, like Pixie or Max, and non-interrupted the development environment. I'm talking about the time-lapse incubator, yeah, to provide the best environment for embryos should be offered in this case. Yeah,
Mhm. Okay.
because yes, I understand that it's surprising and disappointing, but it's still about probability. Yeah, it is not possible to make a final recommendation or any specific explanation after one failure. It could happen.
Okay. Thank you. Thank you so much again for that. All right. Could you have a look at this question? So when you said for fresh transfer, you would synchronize the donor with recipient cycle. Would that be with birth control pills? I heard triggering a cycle with birth control pills reduces the chances of success. Is that
Good
true?
point. Good point. So yeah, preferably we the birth control pills doesn't matter in recipient, of course, because it is not about stimulation. It's only about endometrium. So recipient size, it could be synchronized by birth control pills with no risk. And in donors, we prefer use norethisterone rather than birth control pills because of the reason which is mentioned in this question. Yeah, it's still scientifically it's still questionable, but there are some evidence of medium weight that it's really birth control pills could negatively affect the ovarian response to stimulation. So we rather use something else than birth control pills to synchronize.
Okay, thank you again. That I think that was helpful once more. Thank you so much. We will be slowly finishing, so we will not be able to answer all of your questions, but all the questions that we will not answer today, I will forward to the team at Reprofit, and I'm sure they will be able to help you out. There are lots of questions from you with many details as well, so it's always, remember, best to also get a proper evaluation of your specific situation as well. And the question that I will show you next is this one: Is it worth doing genetic carrier testing for donor egg participant and husband sperm, or is the karyotype test enough to tell about the health of donor egg participant?
No, probably carrier test and the matching of donor based on the carrier test. It is almost for sure the future. Yeah. So
Okay.
so I wouldn't refuse this point of view. And if the couple is using carrier test and matching based on the carrier, because we are able to do it, it is not expensive, not time consuming, we can do it. So if the reason is to improve the chances, senseless, don't do it. But if your feeling will be better when husband and donor will be tested and the match will be okay, let's do it. Yeah, we can exclude some serious disease from your offsprings. It makes sense. Yeah, it is not a routine because it is let's say logistically more complicated, because we have to wait for carrier, we have to compare, we have to open the carrier of donor. So it's logistically, I have to admit, it is not what we like. Yeah, but I think in future, using more sophisticated PC tools, AI tools, yeah, I think it will be easier. I'm almost sure that it is the future. Yes. So if the couple consider it important, let's do it.
Okay. Again, thank you so much for answering another question. And I think that we will be able to take two more questions. I will show you the next one from Lucy. So I have had 5 miscarriages after the birth of my first healthy child at 36. 2 of the miscarriages were tested and were trisomies. Would you recommend donor IVF or continue to try naturally? All of our 6 pregnancies were conceived within 3 months naturally with no
Okay,
medication.
I suppose that the karyotypes of couple is normal. Yeah, because it must be first step, yeah, to exclude the origin in parents. Yeah. So let's imagine the mother, father, or male and female partner were tested and okay. And I would of course, it's about inner feelings also, but probably if I were in the situation, I would struggle with own all sides undergoing PGTA.
Okay. Yeah. Thank you. Thank you for that. And one more question, as I mentioned, I think this will be the final question, but again, I will forward the questions that we did not answer today. The question is, I have history of very irregular periods, sometimes only having 2 cycles a year in the past. How could this affect my chances of successful embryo transfer with an egg donor? Does Reprofit have specific protocols for patients with this condition?
No impact, no impact. Yeah, we standardly use down regulation. Yeah, so it is only what would be recommended here in this case, to take down regulation shot to exclude period or irregularity completely, and there is not reducing the chances. Yeah, the best the best outcome, the best pregnancy rates are in patients without ovaries born. Yeah, so we don't need any ovarian activity or regular ovarian activity for successful egg donation treatment. No, down regulation protocol, and it will go easily.
All right, that sounds good. Thank you so much for reassurance here as well. As I mentioned, that was our final question. There are more questions which I will forward to the team at ProProfit, as I've mentioned as well. So that will be it for today. So thanks everyone for your time and for all of your questions. Dr. Otterberg, thank you so much for joining us once again. I'm glad that we were able to be here and have you here, and thanks so much for all your help. Any final words before we finish for today?
For myself?
Yes.
Okay.
Anything you would like to add?
Sorry for camera is not working. And it was my pleasure. It was my pleasure. So I hope that my brief information, because the topic is quite wide, yeah. So I try to explain it easily, yeah. So I hope my brief information were understandable and reasonable for you. Thank you.
Thank you so much indeed. I think that everything was clear. Remember, it's being recorded, so that means tomorrow you will have a chance to have a look at this. It will be available on our website, My IVF Answers, and on our YouTube channel. And as you know, there are plenty of events coming up, so don't hesitate. Sign up today. We will be back next week with more topics, more events. As you know, there are different topics and different events we now are introducing, so I can only encourage you to join us. So thank you so much for your comments. As you can see, Dr. Paweł, there are plenty of thank yous for your presentation and for your help. So happy to see that as always. And that will be it for today. Have a lovely evening, everyone. And I hope to see you here quite soon as well, of course, with more questions, I'm sure, as well. Thank you so much.